Hey guys, so this will be the last night of me having the top knot. I'm gonna cut it tomorrow, and I know I didn't even have it for like a month, but I was already sick of it, so I just want to document it so I can look back 20 years from now and be like, damn, that was a huge mistake. So this is episode 48, I believe. We're almost at episode 50, so that's crazy. There's been almost 50 videos of me just talking about my experiences, my life in PT school. And most of you guys seem to like it, so that's good. So first, I'm gonna backtrack to March 29th when I attended my first hockey game ever. I went with George, and we basically went as a whole class with all the classmates. It was the Florida Panthers versus the Toronto Maple Leafs. Overall, it was fun. It was a good experience. I just went in a t-shirt and shorts because I completely forgot it would be cold because of the ice rink and everything. Okay, so yeah, I'm almost done with my spring semester. Once I finish my 4-week of outpatient rotation, then we're officially done with the spring semester and the second year of PT school. Yeah, that last week, actually that last month was super tough. Yeah, it was just a little bit overwhelming with practicals and just like 5 tests in 1 week. But yeah, we all made it. We survived. So let's talk about each of the classes. So for gender, we went over, toward the end, the last module, we went over manual lymph drainage. It's like a technique to treat lymphedema, edema. So it's a 4-step sequence where you basically want to move the lymph in the right direction, clear it so there's a path for it to flow in the right direction. So and then the technique is like you stretch the skin and you direct it one direction to where you want it. Usually it's toward the heart or away from the congested zones. Also, to treat lymphedema, there's compression wrapping. We went over this a little bit back in intake. So there's like different layers you just gotta put on, starting with the fingers, wrapping the fingers, and then you put on a different layer, and then you put on the glove, and then you put compressive wrap, starting with 100% tightness here, and then slowly build up to 70%, 40%, so that there's no reaccumulation of fluid down here. And with the wrapping, you're still able to move. It's important to keep moving, do exercises, keep the fluid flowing. So for neuro, the last module was gait. We went in depth learning about the norms, all the norms of the angles at different joint, hip, knee, ankle, knowing what muscles are activated in which phase, which we went over before too. This is like a review, but then learning about what could happen when there's weak quads, causing the knee to buckle, weak tib anterior, causing foot drop and stuff like that. Unable to clear the foot and spasticity, contractures, and just everything dealing with the pathology. And we watched a lot of videos on gait to analyze it. It was part of our practical, part of our written. As for the gait interventions, you can basically do whatever you want to help strengthen the weak muscles and basically to facilitate the normal gait. We learned how to wrap the leg so that the ankles will be in dorsiflexion and eversion instead of plantar flexion and inversion. And we learned like a technique called a joystick, where you put your thumb under the ischial tube and then fingers on the quad and then the pinky toward the hamstrings to kind of facilitate the normal motion, like hip flexion, also knee flexion. You can also facilitate the pelvis in that position too, which is very important with gait because oftentimes you see compensations using the pelvis. Yeah, step ups and just working on clearing, bringing your knees high. With neuro, I feel like there's lots of different things you can just incorporate. As long as you're working them and pushing them in the right direction, then it should be good. We also went over orthotics, learning about different types, AFO, KAFO from the knee, from the hip. The orthotics, they can guide movement or they can also restrict movement, so you have to keep that in mind. We also went over assistive technology, learning about wheelchairs, the different types of wheelchairs, and how to measure the seat depth, seat width, and the back height and everything to make sure you prescribe the correct size wheelchair for the patients. We also learned a little bit about the power wheelchairs. It was pretty cool. We all got to try and drive them around. It's pretty high tech. You can even drive some. If you can't control it with your hands, you can use your head, and it drives pretty well. It's pretty cool. Okay, so for MS3, the last section, we focused on the thoracic spine. It wasn't too bad. It was very similar to the lumbar spine, the cervical spine. Perform repetitive motion on them, flexion, extension, to determine if they have a directional preference. So if they do, it will most likely be a discogenic problem or stenosis. And if they don't, most likely it will be more facet or maybe even a rib problem. There's a low chance of instability with thoracic because of the ribs and how they're attached to it. Differential diagnosis is important with thoracic, especially because lots of visceral conditions will refer pain to that area, whether anteriorly or posteriorly. And also you have to differentiate between a rib problem because they both have pain with breathing, and the rib could be stuck anteriorly, posteriorly, elevated, depressed, depending. And they can also be rotated, internally rotated, externally rotated. If the problem is due to torsion, most likely you would treat the thoracic vertebrae itself first. Okay, so now let's talk about the thoracic thrust manipulation. For the thoracic, there's actually 3 different types. The first one I'm gonna demonstrate is called a pistol. So you first start off by making your hand into a pistol like this, and you have to make sure the grip is very tight, and you place the spinous process in between here. So it lays in here, you put it behind the patient's back. I'm gonna have you reclining. Good. Now can you put your arms behind your neck? Keep your elbows closed. Turn you over. Pistol. Come back. And you flex them until you feel the most pressure into your hand, and then you just lean your body in. Take a deep breath in. Deep breath out. And the second one is called a PA thrust. Lay the patient face down, locate the spinous process of the level you're trying to thrust, and then you will go one hand a little lower, one hand a little higher, twist, so then they're on the transverse process of the same level as the spinous process that you were trying to thrust, and then you just apply quick pressure down, straight down. A little lower than that, and then a little higher. Turn it. Breathe in. Breathe out. So the third manipulation technique was the Nelson technique. I wasn't really good at this, so I had Anna Marie demonstrate it better. This one, there's different variations to it. You can keep the patient can cross their arms like this, or they can do like this. We learn like this, and basically come around, take them to end range, extend a little bit, and the direction of the force is more like you pop your chest diagonally up. It's not really like a distraction, which I was doing it wrong. So a slight distraction, pop your chest out, and that should get you to thrust.
Out pretty far back, and then I put the shirt or the towel under here. Go ahead and cross your arms behind. Under. Make sure your patient is nice and relaxed. You're gonna bring them back here. You're gonna want to make sure you extend out, and then you just come in.
So now I want you guys to rewind and watch that again, because I know you guys weren't paying attention because of Nick. The last part of MS3, we learned a little bit about ergonomics, which is like the science of how people work in their environment. That's important because we treat a lot of work-related injuries, and we want to fix the problem, so prevent any risk of injuries, prevent any injuries from prolonging and dragging it out. So fixing their workspace, teaching them posture, analyzing their work environment, see if their table needs to be raised, if their chair is too high, or stuff like that. I think that'll be it for this video. So I hope you guys enjoyed the video, and thanks for watching.